everybody. Thank you for having me today. So first of all, I'd like to introduce myself. My name is Dr. Aisha Khatib. I'm an assistant professor at the University of Toronto with the Department of Family and Community Medicine. I have a background in family and emergency medicine, as well as a specialization in travel and tropical medicine, and an infectious disease fellowship training in clinical tropical medicine. So working as a travel doctor and as a family and emergency physician, I do work a lot with vaccines, and I also see a lot of influenza, which is what we're going to be talking about today. So why is this an important subject for us to be talking about? Well, the first thing is that we are in unprecedented times with a global pandemic of COVID-19, and we are about to enter our flu season here in North America. And we actually don't know what to expect for this coming flu season. If you look back at history and from the history of the Spanish influenza, for example, and the pandemic that happened back in 1918, we know that influenza was present in 3 different waves. The first wave was in March 1918, which was smaller. A second bigger wave and more fatal wave in the fall of 1918, and then a smaller wave again in the spring of 1919. So it seems to be that history seems to be repeating itself, but it's also important to note that what we're experiencing with COVID-19 is not the same as influenza, as they're completely different viruses. So that's another aspect we're going to talk about today. The other important thing we're going to touch on is what happens when the regular flu season actually intersects with another respiratory infection that's already circulating. And what are the risks associated when you have a co-infection? So a lot of this information is still to be determined. For us today, though, I'm specifically going to be talking about influenza vaccination among seniors and older adults. And so I'm just going to start sharing my screen here. So why are we talking about this today? For the first time ever, we're going to be entering flu season while another respiratory virus is circulating. And we don't know necessarily what this may entail for us, but we need to make sure that we're prepared as much as possible going into this flu season, as well as looking at potentially what may be an implication for the seniors and the citizens of Ontario. So the topic today is vaccination amid the pandemic, a guidance for seniors, and this is presented on behalf of the United Senior Citizens of Ontario. So the objectives that we're going to be covering today are influenza in the context of COVID-19 pandemic, influenza and older adults, recommendations for vaccination in the 2020-2021 year, practical tips for prevention, as well as frequently asked questions. So if we look at what's happening right now with the current pandemic, to date, approximately there are 43 million cases worldwide with over 1 million deaths. So COVID-19 is caused by a novel 2019 coronavirus, which has never previously been known to humans, which is why it's been so challenging going through and navigating this pandemic. Currently, there are a lot of vaccines in trial, but there is no vaccine available at this time. Now, if we compare this to influenza, which we see seasonally and annually, where we get epidemics, which means basically disease spread within a population or community, flu is actually caused by several types and strains of influenza viruses. And the World Health Organization estimates that 1 billion people worldwide will get the flu every year. The World Health Organization estimates that up to 650,000 people will die of flu-related causes every year, with 3 to 5 million cases of severe illness. Globally, it occurs with an annual attack rate of 20%. However, the key is that influenza is preventable, and we have a safe vaccine for this. Now, I'm just going to have a little bit of a throwback to 1918, where we are talking a little bit about the Spanish flu. And although the flu is not the same as COVID-19, it's interesting to see how history repeats itself, with a lot of the measures implemented now being implemented again, that were being implemented back during that time. So when we talk about pandemic influenza, there's always an ever-present threat of risk of new influenza virus being transmitted from animals to humans and potentially causing a pandemic. And again, the difference with a pandemic from an epidemic is a pandemic is when it spreads beyond borders to different countries and continents. The first influenza pandemic that we saw in the 21st century occurred in 2009, and that was the big H1N1 pandemic with over 400,000 deaths globally in the first year. There have been 3 influenza pandemics that have occurred over the 20th century. The most severe and the most famous, of course, was the Spanish flu, and that was caused by another H1N1 virus. And that was estimated to have caused 20 to 50 million deaths between 1918 and 1919. What's interesting about that Spanish flu is the similarity that we're seeing with the pandemic now. And as you know, we're entering or very much have started the second wave of this COVID-19 pandemic. But the Spanish flu also actually came in 3 waves. The first wave was in the March of 1918. The second wave, which was much bigger and much fatal, was in the fall of 1918. And then there was a third wave in the spring of 1919. So we're seeing a little bit of a similarity and pattern with this pandemic. So what is influenza? It is a respiratory infection caused by influenza A and B viruses. A viruses are divided by 2 proteins on the surface of the virus called H and N, which is where we get the names for the viruses circulating that year. And there are potentially 198 different types of influenza virus A. There are influenza B viruses, which are classified into 2 types. The clinical symptoms of influenza include fever, cough, muscle aches, headaches, chills, fatigue, sore throat, nausea, diarrhea, vomiting, loss of appetite, and usually with a recovery in 1 week to 10 days. Now, actually, if you compare that to these symptoms over here, which represent symptoms caused by COVID-19, you can see that there are a lot of similarities between the 2. One of the biggest differences is actually something called anosmia in COVID-19, which is a loss of smell and taste, which we don't usually see in influenza. Transmission from influenza is primarily transmitted by droplets spread through coughing, sneezing, talking, and direct or indirect contact, such as handshaking. The incubation period of seasonal influenza is usually 2 days, but it can range up to 1 to 4 days. And we compare that with COVID-19, where the incubation period can be up to 14 days. Adults may be able to spread influenza to others from about 1 day before symptom onset to approximately 5 days after symptoms start. And children and people with weakened immune systems could be infectious longer. So comparing the 2, COVID-19 and influenza viruses have a similar disease presentation. They both cause respiratory disease that can be asymptomatic or mild through to more severe disease and causing death. Both viruses are transmitted by contact, droplets, and from touching surfaces and then touching your mouth, nose, or eyes, and that can spread that infection. And both can be transmitted before symptoms even start or from people who don't have any symptoms at all. What about co-infection, with getting infection with influenza and COVID at the same time? Now, this has been documented. And potentially it is something that we are worried about going into the flu season with the pandemic happening. One of the concerns is that, could this cause a more severe presentation if you have both of it? The case reports that have come out, although they have been few so far because of the fact that there hasn't been a lot of flu circulating up until this point, have shown that they have resulted in more severe disease with hospitalization and ICU. The complications related to both can result in pneumonia, respiratory failure, something called acute respiratory distress syndrome, where you get fluid in the lungs, sepsis, cardiac injuries such as heart attacks and stroke, multiple organ failure, including that affecting the kidneys, worsening chronic medical conditions, and inflammation of the heart, brain, or muscles, and other secondary bacterial infections. Really, this is a key slide because it really shows annual burden of influenza yearly, where we see over 1,000 emergency room visits, over 12,000 hospital visits, and 3,500 deaths. Now that's annually. We see that already burden our healthcare system. You know, around December, January time, our hospitals fill up. What are the implications of that, though, with a circulating pandemic when we already have, you know, now over 180,000 cases of COVID-19 in Canada, with hospital admissions going up and the deaths going up? So is this going to potentially overwhelm us? Now, I do want to talk a little bit about Australia and a tale of two countries, and basically what happened in Australia and the Southern Hemisphere during their flu season. Now we know influenza has a seasonal variation between the hemispheres, and so in Australia their winter season is between May and August, and so Australia and the Southern Hemisphere actually went into their flu season at the beginning of this pandemic. And what they found was, compared to previous years, they had the lowest rate of influenza than they've ever had before. So could this be potentially a predictor for what we can expect in Canada this year? What was done differently in the Southern Hemisphere? So there was an effective lockdown and reduced travel that happened at the start of their flu season. There were distancing measures that were implemented and improved hygiene measures like hand washing. The other big difference was there was a surge in uptake of vaccines across the country, and they had a record number of vaccines available with a vaccination rate of up to 70% of the population. And since March, over 2.1 million vaccines were administered compared to 624,000 the same time previously. And it was advised to be vaccinated against the flu before visiting any long-term care. Now compare that to the Northern Hemisphere in Canada. Together, influenza and pneumonia are ranked among the top 10 leading causes of death. And previously, we average about 30,000 laboratory confirmed cases of influenza each year, and this is likely reported. But influenza, again, is among the highest deaths related from a vaccine preventable disease. So what's different in Canada compared to Australia? So the difference is that Canada will actually be entering flu season as we're starting to open up and as we enter this second wave of infections. Kids have returned to school compared to in Australia, where kids were actually, you know, because of the lockdown, kept home from school. Travel restrictions are starting to ease with increased import and export of potentially influenza strains as well as COVID-19. And people are getting what we call pandemic fatigue or COVID fatigue. And so there's a lot more relaxed measures of distancing happening. If we compare this to the influenza season that we last saw last year, we had about 55,000 cases detected. Most of them were influenza A, and this is really a key one, is the H3N2 was the largest proportion of cases seen in adults over the age of 65. The cases of influenza B were primarily in younger age groups. So I'm just going to switch gears here a little bit and now talk about influenza in older adults. So first of all, who are the highest risk categories for complications from flu? So it's those over the age of 65, pregnant women, and children under the age of 5. Those with comorbidities or chronic diseases, such as those with lung problems or chronic obstructive pulmonary disease or asthma, those with heart disease, people with neurological dysfunction or people who had previous stroke, for example, those with blood disorders, those with diabetes or other metabolic syndrome, people who are obese, healthcare workers, and those, of course, also living in long-term care. So when we talk about influenza in older adults, we talk about people over the age of 50 as well. And if we actually look at that age group, we tend to see something called immunogenicity, which means something which results in the immune system that naturally begins to decline as you age. And this can actually result in an increased risk of contracting infections. The other aspect to look at in this age group is conditions such as diabetes and cardiovascular disease increase the risk of hospitalization and heart attacks when combined with the flu. For adults 65 years and older, it's actually been linked to 4 major causes of hospitalization. So pneumonia, chronic obstructive pulmonary disease, heart disease, and stroke. 90% of flu-related deaths occur in adults 65 years and older, which is a shocking statistic. The other aspect to look at is something called frailty. And so this is different from age and different from comorbidities or chronic disease. So frailty is basically defined as an accumulation of deficits that affect functioning that can be as a result of ongoing insults to a person, from infection, from stressors or other diseases that can lead to an inability to carry out activities of daily living, such as bathing and dressing or eating. So influenza has an impact beyond the acute illness, which can result in increased care needs. As many as a third of older adults leave the hospital with a significant loss of ability to carry out their activities of daily living. And influenza is a third leading cause of what we call catastrophic disability, which means that at least 3 activities of daily living have been affected, such as bathing, dressing, or eating. And this is just only behind congestive heart failure and stroke. So this is a great picture illustrating the decline of frailty over time as people are affected by different comorbidities, different illnesses. And over time, this shows basically that regardless of age, frailty will cause decline in function, leading to disability. And influenza is a key disease that can actually result in this decline in frailty, leading to disability and leading to the loss of independence. While Canadians adults over the age of 65 only represent 15% of the Canadian population, what's a huge statistic is that 70% of them account for hospitalizations due to influenza, and 91% of deaths are due to influenza in this age category. And if we look at that 15% population, 24% of them are already considered frail and at higher risk, and that's likely because they have at least one chronic disease, if not more. So this is a great infographic, a pictograph from Dr. Melissa Andrew, who's a professor of geriatrics at Dalhousie. And what this illustrates is showing basically the consequences of influenza. And what it shows basically is if you take 100 people who have influenza over the age of 65 who are admitted to hospital, what are the results of that hospital stay and the impact of influenza on that person's activities of daily living or ability to function once they leave? So taking 100, they move on to 68 people who will leave that hospital at their baseline, meaning that they'll be able to function at the activities that they were able to do before they were admitted to hospital. Unfortunately, we see 12 of them will succumb to death from influenza. And what's more significant is that 1 in 5 will have long-term consequences, meaning that they will have a functional decline, leading to a loss of ability to function in a number of activities of daily living. So 9 of them will lose at least 1 functionality, 11 will lose at least 2 functionalities, and 3 out of them may result in 2 or more loss of ability in activities of daily living, leading to them needing to be in a nursing home or long-term care home. So this is actually, if you look at the impact that influenza can have on the independence of an individual just from one insult, and basically looking at the frailty that can result accordingly. So hospitalization can lead to long-term dependence, where over 1/3 of the community dwelling Ontarians over the age of 65 were discharged from non-elective hospital stays to home care, long-term care. And we saw this in 2018, where a third of those who were affected from the independent community had hospitalization and resulted in either home care or long-term care. This also affects residents of the nursing homes who contract influenza, and they can expect a decline in at least one major function. And really, if we look at this loss of independence, one of the biggest fears of the majority of Canadians polled over age 65. If we look at the increased risk of comorbidities and deaths, the presence of an underlying condition further increases the risk of death from influenza. So what this graph shows is that over half of Canadians over the age of 65 have at least one of the following high-risk conditions. So asthma, cancer, COPD, diabetes, obesity, heart disease, or stroke. What's important about this graph is the bar also next door. So the age group of 50 to 64 is actually reaching almost 50% of Canadians with also having a high-risk condition. So that's actually a really important make. I know we talk about those over the age of 65 a lot, but really we should be focusing on those over the age of 50, because really those over the age of 50 will have at least one potential condition, and 50% of them that can result in an increased complication or higher risk from influenza, as well as those over the age of 65. And what are these risks? What are the impacts of influenza that we can see? So directly, they can affect the respiratory system. So those already suffering from asthma and COPD may have exacerbations. You can get secondary ear and sinus infections. You can have bronchitis and pneumonia. There's a lot of indirect effects as well that can affect a lot of the different organs. Heart attacks are a big one. So it can be influenza can actually trigger heart attacks. It can trigger worsening heart disease, and it can trigger strokes as well. There can also be an exacerbation in kidney dysfunction and in diabetes. So for Canadians age 65 and older admitted to hospital with a respiratory complication, the risk of influenza attributed death was 5 times higher in those with chronic heart disease, 12 times higher in those with chronic lung disease, and 20 times higher for those who had both either chronic or lung or heart diseases. What's important to look at is diabetes as well, and not just in those over the age of 65, but with anyone with diabetes. And we're seeing diabetes really increase in the community with those who are having more sedentary lives, with higher weight, and not having a healthier lifestyle. We're seeing higher numbers of diabetes in younger adults. And it actually has a 6% higher risk of hospitalization due to influenza compared to adults without diabetes. And we have seen actually increased risk of ICU admission, as well as increased risk of death related to diabetes and influenza. So I'm going to switch gears here a little bit now and talk to you a little bit about vaccination. So coverage from vaccination, the effectiveness, and again, we'll talk a little bit about that idea of immunogenicity, so that, decline in immune function as we age. So there's a global influenza strategy really put out by the World Health Organization saying that the most effective way to prevent influenza or severe outcomes from influenza is vaccination. The Public Health Agency of Canada also agrees that vaccination is the most effective way to prevent influenza and its complications. And remembering that vaccinated individuals who are protected from influenza will not pass infection to others. So how well does it work? So it prevents 60% of cases overall. It prevents 40 to 50% of hospitalizations in people over the age of 65. It can decrease the risk of ICU and ventilation by 50%. It can decrease the risk of death by 75%. There is some evidence that it decreases the risk of strokes and heart attacks. And remembering that there's a lower strength and persistence of antibody response in those over the age of 65, meaning that we might not get as much of a robust response to the vaccine in those over the age of 65. And we'll talk about why that's a little bit important. So if we look at Ontario's universal immunization program, the vaccines that have been set out for the 2020-21 year for the age of 65 and older, there are 2. So there's a high dose trivalent and there's a standard dose quadrivalent, meaning there's 3 strains of the virus in the high dose and 4 strains of the standard dose. And for those from 9 to 64, there's just the standard dose quadrivalent. And we'll talk about the difference in a little bit. So for the Ontario vaccines for adults 65 years and older, there are 2 vaccines. So the standard dose quadrivalent, which has 2 strains, the H3N2 and the H1N1, and it has 2 B strains. And this is the standard as well for those under the age of 65. It has 15 micrograms of the protein that we talk about, the H1N1, the H and N. And then there's the high dose trivalent influenza vaccine, which has 2 A strains and 1 B strain. The difference is that it has a higher amount of protein, it's 60 micrograms compared to the 15. And why is that significant? So the high dose vaccine, remember we talk about as you age, your immune system is a little bit weaker. And so to create a more robust response, basically the idea is to give more protein and to induce more of a response of the immune system. And so that's why it contains 4 times as much of the antigen compared to the standard dose of vaccine. It has been shown compared to the standard dose to be superior in efficacy up to 24% compared to the standard dose in those over the age of 65. And the efficacy actually increases and benefit for those who are even higher over the age of 75. So some people might say, okay, but wait, you're only giving me 3 strains and I'm not going to be covered for 4 strains. So if you look at adults over the age of 65, they're prominently affected by the A virus H3N2, and we can see that in that graph here, where the predominant strain affecting over the age of 65 is the H3N2. And so it's not as important to really have 2 of the B strains. It's more important to get more protection from the one that's circulating the most that can potentially cause risk. And the other thing to note is likely there is cross protection from the B, there's only 2 types of the B, and so there's likely to be protection for both strains. So for the high dose influenza vaccine, the high dose trivalent is recommended given the burden of influenza A, H3N2, and evidence of better protection compared to the standard vaccine in adults over the age of 65. Now, of course, in the absence of any specific product, any of the available influenza vaccines should be used as it will provide protection. And great news this year is that the high dose for the first time is actually available in pharmacies across Ontario. So that's something you can actually reach out through to any of the pharmacies and or through your family doctor to book an appointment to get these vaccines. So the National Advisory Committee on Immunization is the one that makes the recommendations for vaccine yearly based on we're looking at the burden of influenza throughout the world. The seasonal influenza activity here in Ontario, we start as early as October, usually beginning in November, and it peaks at around the January time. So there's still a lot of time to get your flu shots in. The national goal of the annual influenza immunization programs in Canada is to really prevent serious illness, complications, and death, and to decrease hospitalization, as well as the target rate for vaccination from the Canada's national immunization strategy is about 80%. So where are we when we look at that target? Unfortunately, we're not quite there yet, and we have a little bit of work to do. So those over the age of 65, they're getting the message. And if we look at last year's vaccine coverage across Canada, 70% of those over the age of 65 were getting covered, but there's still a little bit of room there to really hit that target. What's significant, though, is those with chronic diseases here. It's only 44% coverage, and these people are just as at risk as compared to those who are potentially over the age of 65 as a risk factor. And even those between the age of 18 to 64, the coverage rate is low. So remember, one of the key things is getting influenza vaccination means that you prevent transmission to others. So it's really going to be important for those who are younger, those even without chronic diseases, those with chronic diseases, those living with people who may potentially be more vulnerable to higher risk of influenza complications to get vaccinated, because it's a way of not only protecting yourself, but protecting the loved ones around you. And this is actually another way of looking at age, vaccination, and severe outcomes, and it really breaks it down by age category. And of course, we know the complication risk of those over the age of 65 in regards to death and ICU stay. But what's important, again, is to look at those age groups underneath. Again, the 50 to 64 one, looking at that vaccination percentage versus their risk of death from influenza and their risk of having an ICU stay. So, just because you're younger Just because you may not have a necessary chronic disease or comorbidity doesn't mean that potentially you're not at risk for having complication or a severe outcome from influenza. So this is another throwback to 1918. And again, this was one of the advertisements that was put out to really ways to prevent influenza. And again, we're looking at similar ways that history seems to be repeating itself in regards to what we're seeing now during this pandemic. So I know there's a lot of talk about a twindemic, or having flu circulating at the same time as COVID. So what does that mean for us? We don't know, and that's the concern that we have, is we really need to be as prepared as possible going into the flu season during this pandemic. The Southern Hemisphere had such low activity. So that means that we aren't able to predict the evolution of the strains this year. And so we're not able to tell how bad the flu may potentially be. This year will be more than ever to be crucial in getting vaccinated to protect yourself. And one of the other reasons for that is we see that flu and COVID can present similarly. So it may mitigate some of the anxiety around potentially, is this COVID? And do I need to get tested? So if you get your flu vaccine, you're more likely to have less symptoms resulting in unnecessary testing and anxiety related. And again, also to reduce the risk of overwhelming that healthcare system and reduce case fatality rate from the circulation of 2 or more respiratory diseases. And really important here is that unlike COVID-19, we have an effective and safe vaccine for influenza. So it's something that we can do to protect ourselves and our families. So I know there's a lot of questions about the flu and the flu vaccine, and so I'm going to go through some of the most frequently asked questions here that people have. So one of the big ones is, I get a lot of people say, oh, I don't want the flu shot, I don't want to get the flu from the flu shot. So can I get the flu from the flu shot? Absolutely not. The influenza vaccine cannot cause influenza illness. The vaccines that we're giving out this year, they're not live vaccines, meaning they're not dampened down versions of, the actual live virus. People may get a side effect or reaction from the vaccine itself, and that's completely normal for any vaccine, where you can get a bit of soreness around the site. You can get a low-grade fever. You can get fatigue. And this is a normal reaction caused by vaccines to boost your immune response to the exposure, to create that memory for influenza, so that when you're exposed to it in real world down the road, your body remembers what it is. It can mount an immune response to protect yourself. So should I get a flu shot to visit the frail and the elderly? Remember, the vaccine protects yourself from influenza and prevents transmission to others that are more vulnerable. So absolutely, your family should also vaccinate, get vaccinated, the young, the old, to protect themselves and to protect you. Given COVID-19 influenza, both respiratory illnesses, will the flu shot protect me from COVID-19? So remember, influenza virus and coronavirus are 2 very different viruses. And so the flu virus vaccine, the influenza vaccine, will not protect you from the coronavirus for the reason that they're just completely different viruses. So since the complication of influenza is pneumonia, should I get pneumococcal vaccination? If you have an underlying condition over the age of 65, it is advisable to get a vaccine against pneumonia, and this can be given at the same time. So if you're going in for your flu shot, ask your healthcare provider whether or not you may benefit from one of the vaccines that are available for pneumococcal disease and pneumonia. So what if there's a mismatch in the strains in the vaccine this year and the strains circulating? Will I be protected? There is still cross-protection offered from the vaccine. And moreover, the annual vaccination actually stimulates the immune system and antibody response. So likely there will still be protection. And every year there's a bit of mismatch, but we're hitting about a 60% match. And that's actually pretty good in providing protection and efficacy for your protection. Now, a lot of the questions again is, given all the public health measures for COVID-19, do I still need a flu shot? So remember, I like to look at it, I know this is for COVID-19, kind of like a Swiss cheese model, where you have each layer of cheese as a different layer of protection. So we talk about hand hygiene, we talk about masking, we talk about disinfecting common surfaces and distancing, but vaccination against influenza is another layer of protection that can protect not necessarily from COVID-19, but protecting you from influenza, which itself may cause complications and severe illness. But again, you know, looking at the risk of co-infection and looking at hospital capacity will decrease that risk. So, you know, it's just one of the different layers of protection that we can use to protect ourselves. And it's just not a matter of just looking at one thing in itself. We have to look at a multi-pronged approach when we're going into this. So remember, the best way to protect yourself from flu is to get vaccinated. So people with chronic medical conditions, those under the age of 5, those over the age of 65, and pregnant women. And similarly, a lot of the public health measures to prevent flu are similar to those to prevent COVID-19. So cover your mouth and nose with a mask, wash your hands with soap and water frequently, cough and sneeze into your sleeve, you know, keep surfaces disinfected, stay home when you're sick. And remember, continue to follow other preventative measures by public health, including avoiding closed spaces, crowded places, and close contacts. And remember that the flu shot is really your best defense. Immunize Canada has a great campaign happening right now called myflushot.ca, where you can actually go online and find a pharmacy near you or find a doctor's office near you that's providing flu shots. You can book an appointment. You can go to a pharmacy. You can call your family doctor to book an appointment. Flu vaccines are now available across Ontario. And remember that the single act of getting a flu shot this year will save lives. And again, looking back at the Spanish flu, here's another article that came out in the Berkeley Daily Gazette, looking at, you know, wearing a mask and saving your life. And I like this little blurb at the bottom here where it says, you know, doctors wear them. Those who do not wear them get sick. The man or woman or child who will not wear a mask is now a dangerous slacker. So don't be a slacker, wear a mask, and get your flu shot, okay? And thank you very much for listening today. And I'd just like to acknowledge the information from Public Health Ontario, Les Turner for tech support and helping me get this presentation out to you guys, and Sanofi Pasteur for their support through an educational grant. Thank you.